Hi, everybody. My name is Dr. Marcy Press. I'm a physician at UCLA Medical Center. I'm a member of the Barbra Streisand Women's Health Program, and I want to welcome you all here today to the UCLA MD Chat webinar. I'm very excited to be talking today during Heart Month, which is a very important heart awareness campaign, and I want to talk to you guys today about the differences between heart disease in women and men. And I'm going to talk a lot about the differences in, specifically in the diagnosis of heart disease, the risk factors, prevention, and some interesting differences between the different ways that men and women respond to certain medications. If you have any questions, please feel free to Twitter us on the hashtag UCLAMDchat. We will be answering those questions at the end of the talk, and I look forward to hearing from you. And thank you for joining us again. So heart disease is one of the leading causes of death in women, and it's mostly due to disease in the heart and also to stroke. It's actually more common cause of death than cancer, and this is often surprising. I don't know that many of us are aware that heart disease is actually the #1 killer, actually outperforms cancer across the board. And because of its high mortality, it's also responsible for a huge cost in this country, greater than $400 billion a year treating heart disease in this country. If you look at the top 9 causes of death in women across the United States, heart disease is at least 3 to 4 times more prevalent than stroke, significantly more than breast cancer. As you can see, breast cancer is actually number 6. So even though we are all aware of the awful problem with breast cancer in this country, heart disease is actually extremely important, and us being women are significantly at risk. The good news is that since the 80s, we've all recognized heart disease being a significant killer in the United States. Men have actually had a significant improvement over the years with the technologies, specifically newer medications, our emphasis on diet and exercise, changing our patterns in this country, our eating habits, and of course in the technologies that now we have for treating heart disease. This sort of more concerning aspect is that women, although we've had significant improvement since the 80s, the rate of improvement is much slower and lags behind that of men. So we really have some work to do with respect to improving outcomes in women in the United States. If you look at take a female over the age of 40 and you project her 10-year, 20-year risk of having a heart attack or stroke, and you look at 2 different women, one woman who's a smoker who has high blood pressure, and another who does not smoke and has normal blood pressure, normal cholesterol, there's a huge difference in their risk future event rate. So that we're talking about at least a 10-fold increase in risk if you're a smoker or if you have high blood pressure or high cholesterol. You can be the same female and not smoke and reduce that risk by a significant amount. So the good news is, even though it's very prevalent, it's actually something that we can control significantly with just our risk factors. Unfortunately, there are also some other risk factors that may be more difficult to control. There is diabetes, which can sometimes we're born with diabetes, but oftentimes that can also be exacerbated by being overweight, lack of exercise, and then having insulin resistance, which is kind of a pre-diabetic state. I don't know if how many of you have heard about the metabolic syndrome, but having metabolic syndrome is almost as significant of a risk factor as having diabetes itself in terms of your risk of having a heart attack or stroke in the future, and I'll show you some of that. In addition, there are other risk factors like triglycerides, and I'm not sure that we talk about triglycerides a lot. We talk a lot about cholesterol, and in the in the news there are a lot of medications, like I'm sure many of you have heard of, such as statins, which are important in reducing cholesterol, but they don't necessarily have as much of an effect on the triglycerides, which are a different type of cholesterol, which also seems to be extremely harmful in women as opposed to men. In addition, there are certain dietary patterns that can be more harmful in women as well, such as excess carbohydrates. And when we talk about the metabolic syndrome, it's actually defined by just having a waist circumference greater than 40 inches in men, 35 inches in women. You would have to have a high triglyceride level greater than 150, low HDL. HDL is the good cholesterol, so a high triglyceride, a low HDL, high blood pressure, and a high fasting glucose. You only need three of these factors to actually be diagnosed with the metabolic syndrome. Again, this is a pre-diabetic syndrome. If you look at patients who have metabolic syndrome and you compare women and men, women are more likely and more at risk to die of heart disease if they have metabolic syndrome than men. So it's extremely important that we recognize metabolic syndrome in women and we are aggressive in management so that we can improve our outcomes. In addition, we talked about triglycerides. In this study that looked at differences between triglycerides in men and women, women were actually had a higher risk of having a heart attack or strokes if they had a high triglyceride level. And we're talking about a level greater than 89, which is not actually that high. Many of us sort of overlook the triglycerides, but it actually is an important risk factor, particularly in women, which I think is interesting. Will medications that reduce cholesterol prevent or reduce the risk of heart disease? Now, these are the big group of medications I'm talking about here, particularly are the statins. So in men, we certainly know that that is the case. Large studies have shown that statins are very effective in reducing our risk. In women, the data is actually pretty good as well. So if you look at a large study looking at all the cholesterol trials that was published in 2005, and they actually broke down the risks differences between men and women. And the good news is that both men and women benefit from reduction in cholesterol. So that's great news for us. In terms of heart disease, something that's also very interesting is that stress plays a huge role in, can play a huge role in, can be a huge factor in potentially exacerbating or affecting our risk of heart disease. And it's interesting to look at the different types of stress. So men and women actually deal with stress differently. If you look at a study that took women and men under stress and performed a stress test, and they actually compared whether physical stress or mental stress was more harmful to men or women. And they found that women who had mental stress actually had an abnormal stress test more so than men, and that men were more likely to have an abnormal stress test with exercise than women. So stress, just being mental stress, can cause harm to us, and it may be more significant in women than men. If you look at the effects of stress, these things can actually cause worsening blood pressure control, can actually worsen your cholesterol profile. That if you're a smoker, it can actually precipitate or worsen your risk significantly, and it's associated with inactivity and overeating and all the other sort of bad habits that we sometimes think of that we use to deal with stress. So it's very important that we realize that stress is a significant factor in heart disease, and that specifically in women, emotional and mental stress shouldn't really not be overlooked. So how have we changed our thinking about primary prevention in women? First of all, risk factors are important. We talked about those. We talked about diabetes and cholesterol. We also talked about the risk of emotional stress or mental stress being important in women as well as in men. How about hormone therapy and preventive medications and lifestyle intervention? So I'm going to talk a little bit about hormone therapy. It's a huge topic, and I'm not really going to focus on all the data because there's a lot out there. But I'll just give you a couple my take on hormone therapy. In addition, I'll talk a little bit about aspirin. Many people ask about whether aspirin's effective. Is it effective in women? What does it do to reduce our risk? And then I'll finally end with a little bit on exercise. So hormone therapy. So there are two types of hormone therapy. There's the estrogen-only therapy, and then there's the combined estrogen-progesterone therapy. And we often are placed on hormone therapy, particularly at the time of menopause, often to deal with the side effects of menopause, but very often as well to prevent osteoporosis. Now, there was a large study that was published several years ago that sort of gave us a little warning about using these hormone therapies across the board in women because there was a higher cardiac event rate in women who were taking hormone therapy. The good news is that not all hormone therapy is essentially bad for you, and that there's been some recent literature looking that if you do need hormone therapy, it's probably safer to do it when you're younger, closer to menopause, than when you're older, and that's recently come out as well. So in terms of the type of hormone therapy, combined hormone therapy, as I said, has been shown to increase your risk overall, but if you're going to use it, may be safe or beneficial in the early years, less than 10 years from menopause. Estrogen alone is neutral, so I won't talk about that today, but that is something that you might want to ask your physician about if you do have an indication. In terms of medications, I want to talk a little bit about aspirin. Aspirin has been shown in various studies to reduce the risk of heart attack and stroke in patients who are at high risk. So in men particularly, aspirin seems to have a beneficial effect in heart attack prevention, but less so of an effect on stroke prevention, which is interesting. If you look at women, they have the opposite effect. So women, the role of aspirin may be less beneficial in preventing heart attack, but actually more beneficial in preventing stroke. So again, this is a difference between men and women that I think is interesting and important to be aware of. We don't necessarily respond the same way to medications. Now, exercise. So exercise, there's moderate intensity exercise and high intensity exercise. So we recommend that if you're going to do moderate intensity exercise, that you at least try to do 30 minutes 5 times a week. That's sort of the recommended amount. And moderate intensity is anything from calisthenics to cycling, gardening, golfing, swimming, walking. Now, for those of us who like to do more intense exercise, it's things like skiing or cycling or skating or swimming. The recommendations are to do at least 75 minutes a week of high intensity exercise. So if you look at all the potential risk factors for heart disease in this one study, they looked at 12,000 cases across the 52 countries, so this is an international study. And they looked at physical activity to see whether it was associated with risk of myocardial infarction, and they looked over 4 years, and they saw that exercise was actually beneficial. In fact, women may actually have had potentially more benefit than men by exercising. So exercise is a very important modifiable risk factor that can, in this large study, was associated with protection or reduction in your rates of heart attacks. And this was certainly effective in women. So in terms of the differences in heart disease between men and women, I talked about prevention and the role of exercise and understanding your risk factors, recognizing if you do have metabolic syndrome, understanding that if you are a woman, especially with high triglycerides, that it's really important that we recognize as a community that this is a significantly high risk for women, and that we should address these potential risk factors with your doctor. In addition, I did not talk about symptoms very much today, but I can spend some time if people are interested in that. But symptoms of heart disease also are very different in men and women. Men usually present with classic symptoms of chest discomfort during heart attack, and women, the symptoms can be a little bit less obvious. Sometimes it's jaw pain, nausea, feeling unwell. Sometimes it can radiate to the back. You can feel clammy or sweaty. So there are some differences in heart attack symptoms as well. We talked a little bit about menopause and hormone replacement being obviously something that we need to focus on in our peri and postmenopausal women. Finally, exercise being really important to both men and women, and to understand that women may actually potentially benefit more according to one study. And stress being a significant risk factor, again, both for men and women, but understanding that there are different types of stress and that women may be more susceptible to the emotional stresses that can certainly lead to or potentially put us at higher risk of having heart events. Finally, the differences in medications, the beneficial effects of lipid lowering in both men and women, but the important differences in potential role of aspirin and its risk reduction between heart attack and stroke in men and women. So I'm going to finish up today and just let you know that even though heart disease is the #1 cause of death in the U.S., it certainly can be prevented and we can control this. Certain lifestyle changes and medications, if needed, are effective for that. Really, going forward, we really just need to focus on awareness and diagnosis and continued treatment because it's working. There are clearly improvements in the outcomes of women in this country because of all our efforts and our focus on this topic. So we still have a long way to go, and it is important for us to continue to do studies in women so that we can recognize and continue to recognize the differences. Thank you very much. So I think I have some questions. So I think the first question is, how do heart attack symptoms present in women and men? So I answered that a little bit. So we talked about when women typically can present with the standard chest discomfort, but sometimes women present a little differently. So sometimes it can be anything from feeling unwell to a sense of nausea. Sometimes it can be jaw discomfort. Sometimes it can be neck pain. Sometimes it can be arm pain. So there are certain things that we need to pay attention to and educate women that it doesn't necessarily always just present with chest discomfort. So how common is heart disease in women before menopause? So this is a great question. We used to think that menopause, that being a young woman was very protective and that hormones when you're younger are protective against heart disease, and that was one of the explanations why men get heart disease at younger ages than women, because they don't have those protective hormones. But we're starting to really recognize that all heart disease is becoming more common the younger we get. And regardless of gender, the heart disease is prevalent in the younger population in this country. And we really need to start making changes at a much earlier age. And this is something that I'm not sure we recognized several years ago. So yes, it's true that there are less women that have heart disease before menopause and post-menopause, but I think that the numbers are still probably under-recognized, and I think we probably need to do some more studies on that topic. What is the link between heart disease and diabetes in women? So the study I was discussing about metabolic risk, about metabolic syndrome, basically, and I can go back to that slide, showed us that metabolic syndrome was associated with a higher risk of, I'm going to try to go back, of higher risk of heart disease than patients who don't have the metabolic syndrome, and that this was more prominent in female patients. This is very similar to the trends in diabetes, but diabetes is an important risk factor, again, for both men and women, so not to be overlooked. Is the risk of death from heart disease higher for Black women? So that's a good question. So, there certainly are differences in both racial and gender differences in heart disease. I would say that that Black women are at least as much at risk as the general population, and that it probably is an area that needs further research as well. But yes, I think that Black women are particularly at risk of heart disease, and this is often a population that gets undertreated, under-recognized, and something we need to focus on. So what can women do after menopause to reduce their risk of heart disease? So the things that we can do are basically lifestyle modifications. So really seeing your doctor regularly, checking your blood pressure. Blood pressure is something that is silent. It's often something that we don't know we have high blood pressure until maybe years of being untreated. So I would say seeing your doctor regularly, checking your blood pressure, making sure that you are up to date on all your blood work, that you have a diabetic screen, that your cholesterol profile is up to date, and really that you really follow a healthy diet and exercise. Those would be the main things that I would recommend. Obviously, things like smoking, highly, highly, highly encourage that by that time that we should obviously not be doing. But specifically after menopause, I would say all the other risk factors that are preventable, like blood pressure, weight, management of diabetes, and smoking cessation would be the big ones. So is that it? All right. Well, I want to thank you guys all so much for listening to me. It was a pleasure being here today, and we'll stay in tune. Okay? Thank you.